Hello everyone, welcome to my YouTube channel. Today we're going to be talking about bullying in nursing, really bullying in healthcare in general. In the last video I shared my experiences with lateral violence, which is when your coworker bullies you. And in this video I'll be giving tips on what to do if you experience bullying at work or if you see someone else experience it. So my first tip is patient comes first. I know that sometimes when you're uncomfortable at work or you don't feel seen or heard, it can be hard to ask for help, or if you don't know something, it can be hard to ask someone, or if you don't know how to do something, it's sometimes hard to ask someone to teach you. But patient safety first. You don't want for something to happen and you have to take fault and the only explanation that you have is you weren't comfortable asking for help. So patient safety first, always. My second tip is try not to isolate yourself. I have a mentor at Penn, his name is Dr. Howard Stevenson, and he talks more from an academia perspective, but he talks to me about bodyguards. He'll talk to me about bodyguards he had when he started academia and people he had to be bodyguards for. So he often tells me if I go somewhere and I don't have a bodyguard, that means I'm probably gonna have to be somebody else's bodyguard. And sometimes that's what happens. Like maybe on your unit, you're the only Black person, and because of that, you've been targeted by coworkers and patients. But then there may be just one person, one ally that can help you on that unit. So even if the majority of the unit is being prejudiced towards you, try not to close yourself off to everyone. 3, kind of goes with the last one, snitch. If I've learned anything these past couple of years is that someone has to know what you're going through. Whether it's your bodyguard, your manager, if you have to escalate it to HR, do that. But you have to let somebody know what you're experiencing. My fourth tip is stay on your P's and Q's. So sometimes people who seem like bullies, they may just be a little judgmental. They might just see a pretty face and think that you don't know anything, and because of that they can be a little more aggressive with you. But from my experience, when I've come in and people just think, you know, I'm just some cute girl who's just playing at work, once I show them that I care about patients and that I'm knowledgeable and that I really want to learn, then they start being much nicer to me. And usually that's the case with aunties. If you're Caribbean or African or some other foreign culture, then you know what an auntie is. Sometimes they're just a little more rough and a little more blunt, and it could be due to cultural experiences or just life experiences, but sometimes that happens. And once you show them that you know what you're talking about and that you care, then they end up being so much nicer. There's been people that I've worked with that I didn't think liked me, and now when I see them, they're like hugging me and kissing me and trying to hook me up with their sons and nephews and all types of stuff. So sometimes they just want to know that you actually care. My fifth tip is if things get really bad, you might just have to leave. And I know sometimes our pride doesn't want us to because you feel like everyone else won, but no, like if they lose you, that's a loss. And if you have to go to a different unit, a different institution, even if you have to go to a different state where nurses look more like you, like I'm in the DMV, so most of the places I've worked have been very culturally diverse. And I'm thankful for that. But I've also talked to nurses where they'll say they're the only Black nurse on their unit, or they're the only NP with their own practice and that's Black in a 90-mile radius. And to me, that would have been very difficult for me to experience. So if you have to leave, know that there's places where nurses are nice, there's places where nurses are helpful, and maybe you have to leave to go find them. And my last tip is if you don't want to leave, then maybe your best bet is to refer nurses to your unit. So I know that things aren't easy for you, but maybe if you had a couple of friends on the unit, it would help. Having friends on the unit or even making friends with your coworkers always makes the job way more pleasant and is honestly better for the patients too, because you're more likely to work together. I always become friends with my coworkers, and I'm really thankful for that because I've learned a lot from them. And that's really the best tip that I have, but sometimes that's not possible. So if you are experiencing really bad lateral violence or have in the past, my heart goes out to you, and I'm so sorry that nursing doesn't look like what you thought it would look like, but that doesn't have to be the case. I hope that my tips can help someone, and if you've had some experiences that you want to share or some tips you want to share, please leave a comment below, and don't forget to like, subscribe, and share, and I'll see you guys next time. Be nice to your coworkers. Bye.